in pharmacies, we see a spike in sale of the emergency contraception, also known as the morning after pill, which some people also call Plan B. And if you actually check the Urban Dictionary, there is something called the National Plan B date. And this, believe you me, is actually the day after Valentine's Day, that is February the 15th, in which Planned Parenthood and many pharmacies experience a spike in sales of the morning after pill.
Wow.
So it is a topic that I think we should really be talking about today.
That's right.
Now, I was just reading somewhere, Steph, that millennials have, there was a survey that was done, and millennials say that they have more sex on Valentine's Day than any other time of the year. And they surveyed about 3,000 18 to 34-year-olds. And what also they found out is in March, there is a spike in sales of pregnancy tests. So I'm sorry, we're going to reduce that sale this year because we're going to gear you with enough knowledge, enough information as to how you can avoid being one of those people who are buying the pregnancy test in March because, of course, of unplanned pregnancy. Of course, if it's planned, by all means, but if it's unplanned, we are here for you.
Yes.
So, Steph, let's just talk about, first of all, the morning after pill.
Yes.
Why is it called the morning after pill?
Yep. It's usually the pill that you take if you have unprotected sex and you want to prevent yourself from being pregnant. And the reason it gets its name morning after pill is because usually people take it the morning after, unprotected sex. And I'm sure many people have had it. It usually works by basically preventing pregnancy after unprotected intercourse, like I said, and it prevents or delay ovulation. So it's quite important to take this straight after you've had sex. And there are two types, actually. Let's get into it. So we have the 72 hours one and we have the 5-day one. So we have the Levanel and we have Ella one. Ella one is the 5-day one, and we have the Levanel, which is the 72 hours, so 3 days. And obviously, you don't want to leave it until 3 days time to take the Levanel. It's best to take it obviously straight after sex for you to get an effective result. And the Ella one, it usually has a lasting effect, I think, for 5 days. But again, it's best to take it as early on to prevent you from getting pregnant.
Yeah.
Please do not mistaken this to your regular contraception. This is just to prevent you from getting pregnant after sexual intercourse.
Yeah.
Yes.
And there is also when it comes to the pills, there is the two stuff. You're right. There is the Ella one and there's the Levanel, but there's also the copper coil, which is also a form of emergency contraception. Now, the copper coil is apparently supposed to be the most effective of the emergency contraception, just I think because of the way it works, and it is also something that can be used as a long-term contraception. So with the copper coil, it basically releases copper into the womb, which kind of alters the cervical mucus. This makes it very difficult for the sperm to reach the egg because of the mucus. Therefore, the egg will not be fertilized. And people who say are not very good with taking medication, this would be maybe another way of the emergency contraception where you can get the copper coil inserted, and it can last sort of 5 to 10 years. Now, a lot of questions I think we get, Steph, is how effective is the morning after pill?
Yes.
Yes, a lot of people
Yes.
say, wait, so if I take this, does it guarantee I'm not going to have a baby? I'm not ready for a baby, you know? And a lot of people even say, you know what, do I have to do? It's cheaper than a baby. 100%
Yeah.
it is. But how effective is the morning after pill?
As I said earlier on, with the Lebanon, if you take it within 72 hours after unprotected sex,
Yeah.
it can reduce the risk of pregnancy up to like 87%. But if you take it within 24 hours, it's even more effective.
Yeah.
So, I mean, your chance of getting pregnant within like the first 24 hours is, when you take the Lebanon, it's very low, so it's best to take as early on as you can.
Yeah.
Same goes with the Ella one as well. The earlier you take it, the better. But with the Ella one, if you go beyond 3 days, you still have that chance of it being effective, unlike
Yeah.
the Levanel. Yeah. But do you know something? I have a story to tell you.
Go on.
I actually have like 2 people that have gotten pregnant after taking the morning after pill.
No way.
I am telling you.
Oh, and you know these people.
And I know them.
Oh,
So
wow.
one of my friends, she like her first pregnancy, she said, oh, she took the morning after pill. She was so sure she was not going to get pregnant. And
Right.
then later on, she got like she missed her period and she found out she was pregnant. She was so upset. Just like, how can I? But
Course.
everyone's body is different, and also
Yes,
she was,
100%.
so
Yeah.
maybe at that point where she took it,
Mm-hmm.
the sperm and the egg had already fertilized, so
Yeah.
unfortunately it did not work. But also,
Oh.
people need to be a bit wary because
Mm-hmm.
maybe that medication had been expired, or
Yeah.
maybe it was not original. So just be
Mm-hmm.
careful. So that is
Oh,
something that I
wow.
think may have happened. Yeah. But
Yeah.
yeah, she was so distraught because she
Oh,
didn't
bless
plan on that.
her.
Yeah. And the other
Oh.
one was actually Ella one.
Mm-hmm.
And my other friend as well, she said she took it, but she left it a bit later.
Mm-hmm. Ah.
Do you get like, I know Ella
Yeah.
one, if you take it within like 5 days, you
Mm-hmm.
still have the possibility of like reducing the pregnancy, like of not being pregnant. But she
Yeah.
took it, I think maybe like the 3rd day or so. And for
Mm-hmm.
some reason, she was one of the unfortunate ones where she still got pregnant even after taking the Ella
Oh,
one,
my
like on the
goodness.
3rd day. Yeah.
Yeah.
But the earlier you take it, honestly, the more effective it is.
Mm-hmm. You've hit that right on the on the
Yeah.
head, the nail right on the head. Because I think most people, what they say is that like, as I said to you earlier, they say, oh, so does it guarantee that I'm not going to get pregnant? No, it doesn't
It
guarantee.
doesn't.
There
Yeah.
isn't any contraception that's 100% effective, and the morning after pill is actually no exception. So it can
Yep.
delay ovulation, but you need to remember that if the egg has already been released close to the time of you having unprotected sex, then you can still get pregnant. So you could take it, but maybe your egg was already released. Maybe the egg was just
Yes.
in delay. So you're likely to get pregnant that way. And I think what is also important is when you're going to get your morning after pill from your pharmacy, from your pharmacist, it is important to be very honest as to a lot of the
Yes.
questions that's being asked, because a lot of people just want to take it, right? So the pharmacist can ask you something like, are you on any medication? And then you're on some medication, but you're thinking if you say it, you might not get it. But you don't
Yeah.
realize is if you don't say it, you're not putting all the information out there that could be crucial to making sure you actually get the right treatment. So because there is a lot of medications that can actually affect how the morning after pill works. So if you're on the likes of, say, anti-HIV drugs, some of the antibiotics, anticonvulsants, things like that, they can actually
Yeah.
affect how the morning after pill works. So it's very important if the pharmacist is asking you, are you on any medication, just be as honest as possible as to what
Yes.
medication you're on, just so you get the right treatment, basically.
Yeah.
And it's good we mentioned, you get it from the chemist, because I think a lot of people don't realize that they just think you can just go into a pharmacy and you can buy the morning after pill. But unfortunately, that might be the case in I don't know, some places, but in the UK, unfortunately, after a consultation with the pharmacist, is only when you can actually buy the morning after pill. So just so you're aware, if you've had unprotected sex, it's not the end of the world. Go to the pharmacy, have that chat with your pharmacist, and if it's suitable for you, you will more than likely get the morning after pill.
That's right.
Yeah, and also it's worth mentioning that if you are, say, taking the morning after pill during the same cycle, let's say you've had 2 morning after pills in the same cycle, it can be okay. It's ideally you shouldn't take it because it can make it less effective, but just be honest as well with things like that, because a lot of people are like, I'm not going to say I've had it already because I need it, but you don't realize you're not letting the pharmacist know things like that could be actually the reason why this might not be effective for you.
That's right. Yeah, and I think some people as well feel like, they can only have like the morning after pill, maybe one at a time.
Yeah.
In a cycle. But you can have it as many times as you can in the cycle. But so always make sure that you mention it to your pharmacist. Don't hide that. Don't feel that, maybe because you had it on day 1, you can't have it on like day 3. And one thing also that I wanted to mention, if you do have the morning after pill, it doesn't mean that you be protected maybe the next day or 2 days. So if you have the morning after pill, still use like a local barrier.
Yes.
Until your next cycle, make sure that you're still using like a local barrier, because just because you've taken a morning after pill doesn't protect you from the rest of the days. It's not a birth control. So that's one thing I think people sometimes get confused about.
That is very true. That is actually very true. I think it's good you mentioned that, because a couple of weeks ago, I actually got a mum on the phone about her daughter. Now, the mum was like, can I speak to the pharmacist? I went on the phone and she was like, my daughter has currently been put on the microgynon, which is a combined oral contraception. And she was like, and she has only taken it a couple of days. And unfortunately, she just told me that she had unprotected sex with her boyfriend. She's 18. And I was like, okay, do you want to come to the pharmacy? So they come to the pharmacy, we had a chat. And of course, because of the time that the period she'd taken it, she was not protected from her regular contraception. So she had to get the morning after pill. Now, this is where it got a little bit crazy. So, she got the morning after pill. I could see her mom was like, girl, this is, you have to be careful. This is like your life we're talking about here, kind of thing. And, we did the purchase and she left. And then the next day, this boy comes in and he wanted to have a consultation with me. And I could remember seeing this boy somewhere. I just didn't remember where it was. I've seen this boy. So we go to the consultation room and he just wants to have a consultation about unprotected sex. And I was like, yes, of course, this is a safe space. You can have this conversation with us. And he went on to say that his girlfriend had the morning after pill the day before, around 4 p.m. As soon as he said, I knew it was the same girl who had just sold the morning after pill to, whose mom had dragged into the pharmacy. And he goes, and last night we had, so he goes, I think it was, I can't remember actually very well, if it was that night, the night before, or that morning when he came to the pharmacy, that we've had unprotected sex. And he's just wondering what happens then.
Mm.
And I was like, okay, first of all, nothing, don't worry too much. Ideally, it would be good to have that conversation with the girl. So if she's able to come into the pharmacy, I would want to have that conversation with her. But just so you know,
Yeah.
the pill that she had yesterday does not protect her today, or protect her after you've had unprotected sex. So it doesn't
Yeah.
it doesn't cover like a period of time. You don't take it now and it covers you for 3 days. So those 3 days
That's
you can do
right.
whatever. No. And I did say to the girl actually that for the next 7 days it's very important to for extra precaution. So barrier protection on top
Yes.
of course your regular contraception. But I think she's just one of those, she got carried away, I don't know. So it's good that you've mentioned that, Steph, because a lot of people
Yeah.
don't realize that you take the morning after pill today, it doesn't necessarily cover you for a few days.
That's right.
Unfortunately, this girl didn't come back because
Okay.
it would have been a matter of maybe just referring her to her doctors and just to make sure that she's okay to maybe get another morning after pill. But I do
Yeah.
hope that wherever she is, and she's okay and she's safe, and
Yeah.
she's looking after herself.
Definitely.
Yeah.
Definitely. Yeah.
And I think just sort of building on that point, if you're on, say you've started taking the regular contraception, if you're on the combined pill, if I remember correctly, you have to have taken it for up to 7 days for it to be effective. And then when you're on the progesterone only pill, you can, after 2 days of taking
2
it,
days.
you will be
Yeah.
protected. So just bearing
Yeah.
this in, you're not protected straight away. Okay. So
Yeah.
please use barrier protection. And if anything happens, get the morning after pill. It is very,
That's
very
right.
important.
I think it's worth mentioning also, sometimes some people get some side effects after taking the medication.
Yeah.
Some people, common side effects that some people go through is like nausea and maybe abdominal pain. I think it's worth mentioning if it gets to like you physically vomiting, especially maybe 2 hours of like taking the Levanil,
Yeah.
or 3 hours of taking like the Ella1, it's worth mentioning that you will not be protected.
Yeah.
So you may need to take another dose if you vomit, within those times of taking the medication.
Yeah.
I think that's why some people opt for like the IUD, like you mentioned.
Yeah.
Yes, because that one is a lot more effective. Yeah,
It is.
but that is one thing that people need to bear in mind. If you're feeling sick and you are physically sick, within 2 hours or 3 hours of taking the Levanil and the Ella1, please take another dose, because that means that you're not protected. Okay.
Yes, that is
So
so
Trudy,
important.
what other side effects might one experience from like these pills?
Some people also experience some of abdominal side effects, so abdominal discomfort, abdominal pain, which is
Yeah.
normal. But of course, we always say with side effects, if it's getting in the way of life, if it's getting too severe, maybe you should seek you should seek some help, or just advice, just to make sure that it's not something that that could be causing you harm. So those are, to be honest, those are the two most common side effects when it comes to the morning after. There is other side effects, but they're not very common. But what also normally could happen is you might get spotting in the next few days. So some women experience some spotting in the next few days. So a few days after taking the morning after pill, also known as Plan B, you might experience some spots of blood on your just coming from your vagina, and that is totally normal. That is totally okay, but you shouldn't count that as a period to start with. Of course, if there's anything to worry about, or if you feel like maybe it's something that you are a bit worried about, it's not just spotting, it's coming with pain, it's coming with a lot of discomfort, seek medical help. But spotting is something that is
Yes.
very, very common. A lot of women experience spotting right after the morning after pill. And also they might also get delayed period. So if
Okay.
you are expecting your period 2 weeks after taking the morning after pill, you might get it 4 weeks after, 3 weeks after. It can basically, because of the way it works, it kind of imbalances your hormones. So you might get your period sooner than you expect, so earlier than your scheduled period, or a bit later. But of course, if you are a bit worried, and normally I normally say to most patients, if you get it a bit later, don't panic. Or if you don't get it on the day you're expecting it to come, don't panic. But of course, if you want to test for anything, you can always test sort of like 3 weeks after taking it, just to make sure everything is okay. And if maybe you've missed your period for over 7 days, it is worth maybe just testing, just to make sure everything is okay. But of course, if you need to speak to someone, a healthcare provider, your local pharmacist, maybe your GP, maybe your doctor, it is worth doing it just for your own peace of mind.
Yes. I wanted to ask you, so what are some of like the bizarre myths you've heard about the morning after pill?
Oh my God. Do you know what? In my life as a pharmacist, I've probably sold so many morning after pills, and every time there's always someone asking a question. I'm like, wow, that is new. I've not been asked that. And there is a lot of myths about the morning after pill. So first of all, people, a lot of young girls are normally concerned about the morning after pill permanently disrupting their menstrual cycle, which is actually false. It doesn't permanently do that. It's not that you have you take the morning after pill and going forward your menstrual cycle is just going to be all over the place. That's not quite right. So your next menstrual cycle might be slightly abnormal, as we said. You might get you might bleed a bit heavier, a bit lighter than usual. It might be a bit sooner, a bit later, but it goes back to normal almost straight after. So the same way we said that, right after you've had the morning after pill, it's very important for the next 7 days for you to keep protecting yourself via barrier methods. It is very important to keep that anyway, because your fertility and just your menstrual cycle will go back to normal almost straight after. So that is a myth. It does not disrupt your menstrual cycle permanently. Yeah.
Okay, brilliant. I think there was before there were like myths about people buying the after pill, like if you're underage. What is like the restrictions when it comes to the age, who can get it, where can they get it from? Yeah.
To be fair, in pharmacies now there is a lot of there's a lot of questions as to who can get the morning after and who cannot get the morning after. Unfortunately, we don't always ask for ID because it is something that a woman might want. And if she doesn't have an ID, then that could mean that maybe you're actually getting in the way of her preventing something that she's not quite ready for. So, essentially, it shouldn't be used, it shouldn't be bought in pharmacies for anyone under 16. Anyone under 16 should ideally seek their doctor's advice, just because again there could be a lot of complications and things like that. There is instances where young girls have bought the morning after pill just because maybe they've lied about their age, or there has been some circumstances where they really need it because of whatever has happened, which again, I feel like with every sale of the morning after pill, it is very individual. We'll take normally each case very individually. But I always say if you're quite young and you feel like maybe you need the morning after pill, and it's not something that you kind of, you're ready to talk to, say, your parents about, because you're not quite comfortable talking to them about it, you can always come to the pharmacy and we will either do a consultation on what is best for you, or we will signpost you on where to go, just to make sure that you get the best help.
That's right. Okay.
Have you heard, Steph, the myth about the morning after pill being an abortion pill?
Yes.
Yeah.
I mean, like, people, I think it all depends on people's beliefs. Let's just put it that way, right?
Yeah.
Because let's just because I don't want to offend anyone. People might say it is an abortion pill if you put it that way, because it all depends, as we said earlier. If, for instance, you do have like unprotected sex at a time where maybe you're ovulating, there is a high chance where the sperm could unite with the egg very quickly and you may get pregnant. And the morning after pill may stop this. So in essence, if you believe that, the morning after pill does prevent you from getting pregnant, you will believe that is an abortion, because really it has stopped you from getting pregnant. But it is not an abortion pill per se. Let's just put it that way. There are abortion pills, there are abortion methods, but this is not an abortion pill. So that's what I was saying. It does depend on your belief, because if you feel you got pregnant at that first instinct, yes, and you believe like you've killed your baby at that time, that is an abortion. Yes. Right? But no, it is not an abortion pill. It just prevents you from getting pregnant. So that's different. An abortion pill is where you are pregnant and then you have taken the pill to get rid of that pregnancy. But the morning after pill prevents you from getting pregnant. So that's the thing that people need to clarify
get right
on.
The morning after pill is, you're right, it is only capable of basically preventing pregnancy by delaying ovulation. So if there is no egg in the fallopian tube, then the sperm cannot meet it and fertilize it. So it's preventing that egg from getting farther sort of down the steps of you being pregnant. Hence why I personally don't think it is an abortion pill, and it really, science has proven it's not really an abortion pill. But also, just to also mention that if you are already pregnant, the morning after pill is not going to act as an abortion pill, i.e. it's not going to kill that baby. If you're already pregnant, the morning after pill is actually safe for the baby, meaning that it will not basically harm the baby. You will still be able to have the baby if you want to, unless of course you go through other means. But the morning after pill is not really an abortion pill. And I think you mentioned something earlier, Steph, which is that some people use they misinterpret what the morning after pill is, and they use it as a regular contraception. But as the name suggests, it's just an emergency contraception.
That's right.
It's when you have used other ways of contraception, and even a barrier method is a way of contraception. You've used other ways of contraception and it's not been effective, or maybe you've not used any contraception at all, and you're in a situation where you feel like maybe something happened, an accident happened, and you don't want it to get any further. Hence why you go for the emergency contraception.
That's right.
Yeah, if you want a regular contraception, there is a number of regular contraceptions out there that ideally you should speak to your doctor, your GP, maybe your pharmacist for extra advice. Now they actually do sell contraceptions over the counter. So if you are looking for a regular contraception, if you feel like maybe forget Valentine's Day, but if you feel like on any other sort of time of the year, you are using a lot more of the morning after pill or the emergency contraception, it is worth talking to a healthcare provider about what options you have, because that might be suitable for you, including, of course, the copper coil, which is it can be used as a regular contraception. So it is the emergency contraception should never be mistaken for a regular contraception. There is regular contraception. It should only be used in emergency cases.
Yes.
Yeah. I think the only other myth I've heard is that if you use the morning after pill, it protects you from STIs. That is actually something that young girls ask me, like, oh, so does it mean that I can't get anything? No, that is not right. One of the advice I want to give most of my patients is once we're going through the whole consultation with the morning after pill is if you want to test for STIs as well, ideally you should do it after taking the morning after pill, because this tablet is not going to protect you from STIs. It is just going to prevent you from getting pregnant or prevent ovulation if you prevent fertilization if the egg is not fertilized already, but it's definitely not going to prevent you or protect you from STIs.
That's right.
Yeah. Anything else, Stephanie, you'd like to add? Anything, any stories you've heard that is worth sharing on the morning after pill?
Oh no, those were my main two ones, those stories. It's just, everyone's body is different. And as I said, the earlier you take it, the better it is. Yeah, the better it is. And honestly, always speak to your healthcare providers to get the right information. Make sure that you give them your history, give them the medications you're taking so that they'll check that it doesn't interact with it. Make sure you read the leaflet as well, just to tell you what you should do when maybe you vomit or any side effect that you do experience, what you need to do. But I think that is it for me. What is your take home?
Well, my take home message in regards to this topic, the morning after pill, or the emergency contraception, is that it is safe and effective option if used responsibly and if used correctly. So it's very important and it's essential to be very informed about how available it is to you, its usage and potential side effects, so that you're able to make informed decisions on your reproductive health, basically. So it's very important that before you go on the morning after pill, have a consultation with a healthcare professional, your pharmacist, your doctor, someone you're comfortable with, on what is what is best for you. Now, if you need to come into the pharmacy with a chaperone, so a friend, or if you maybe are comfortable coming in with your mum, it is okay, as long as you let the pharmacist know that you want someone like that to be there with you. It is okay, and it is important just to have that support as well. So if you have that support, it's very, very important, but it's important also to bring someone you trust, because we all know we live in a world where some things can be taken and twisted, and before you know it, it's used against you. So just make sure you're talking about some of these things to people that you trust, but also make sure you're surrounding people that you trust around you, because your health is very important, and your reproductive health even more important.
Good. Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.